So you're seeing something off with your child's smile, or maybe your dentist mentioned a palate expander and you're not even sure what that even means. Before you make a decision, here are the signs that you should never ignore and how early treatment could make a huge difference. I'm Dr. Jeremy Manueli, board certified orthodontist and dentofacial orthopedist, and I'm glad you're here. We're gonna start by talking about mouth breathing. It's not normal. Let's start here because this one's big and it's often ignored. Mouth breathing in kids is not normal. I know what you might be thinking. Well, half the kids I know about do it. And you're right, about 50% of children are chronic mouth breathers. But just because something is common doesn't mean it's normal or healthy. Here's the problem. When you breathe through your mouth instead of your nose, you bypass the body's natural filtration and air conditioning system. You lose out on nitric oxide, which is produced in the nasal passages and sinuses. Nitric oxide isn't just some throwaway gas. It's a vasodilator, meaning that it helps to open up blood vessels. It's also antimicrobial, antiviral, and plays a role in oxygen delivery. When you skip it, your body misses out. Mouth breathing decreases oxygenation, dries out the mouth, and sets off a chain reaction of potential problems. And we'll talk more about that in a second. Now, if you're seriously considering improving your facial balance or correcting jaw and bite issues the right way, our team at Hamilton and Manueli Orthodontics can help. If you're in Las Vegas, head over to hmortho.com to book an in-person consultation. And if you're not local, you can head over to vegasorthodoc.com where you can securely upload your records and we'll review everything together remotely to see what's actually possible for your face and smile. So now let's jump into one of the biggest clues parents often overlook, and that is snoring. Snoring in children is never normal. It's a big red flag, and even if it's only happening occasionally, you need to pay attention. Snoring isn't cute, and it's not something that they typically just grow out of. In fact, the opposite tends to happen. As kids get older, those soft tissues become more floppy, not less. So if they're struggling with airway resistance now, it's likely going to get worse over time, not better. Snoring is a signal that something is blocking the airway. And the top 3 anatomical areas you need to be thinking about are the tonsils, the adenoids, and the jaw size. Now with jaw size, this is where a palate expander comes in. As orthodontists and dentofacial orthopedists, we used to struggle to figure out whether the upper jaw was too small. But now with 3D imaging and a lot of amazing data from long-term growth studies, we can actually calculate how much the jaw should grow and compare that to how much they've actually grown. And if there's a discrepancy between those two, we can intervene early. In my own family, all 4 of my kids had palate expanders, and my youngest son had his at around age 5. And you know what? It worked beautifully. At that age, the bones are softer and the process is easier. It doesn't hurt at all. Plus, it gives Mother Nature a big head start in improving the breathing, function, facial growth, and even the whole crooked teeth situation. But snoring isn't the only warning sign. Even baby teeth can reveal a bigger problem in the jaw. Have you ever seen crooked baby teeth? That's a big clue. And it's one of the biggest red flags that I see. Having crowded or crooked baby teeth is not normal. Here's the truth. Baby teeth are supposed to have spaces between them. Why? Because permanent teeth are bigger. If you see crowding in the baby teeth, there's almost no chance that the adult teeth are gonna have room to fit in without issues. If this crowding isn't addressed, it can lead to impactions where the teeth are trapped and don't erupt normally, and sometimes these require surgery to expose them. It can also lead to root resorption, where the roots of the adjacent teeth start to dissolve others, just like in this case here. Another thing it can lead to is extractions, where permanent teeth have to be pulled just to make space, ignoring what may be the actual issue of a small upper jaw. We'd rather prevent these things by making the jaws the right size from the beginning. Next, let's talk about gum health, because what looks like mild inflammation could actually point to an airway issue. Puffy or inflamed gums. Let's take a closer look. You might not expect this one, but if your child has puffy or red gums, especially on the front teeth, it might not be just a brushing problem. It might be a sign of mouth breathing. When a child breathes through their mouth, the air dries out the tissue and it becomes inflamed. The upper jaw itself shares its bone with the floor of the nose. So when we expand the palate, we're also widening the internal nasal passages, making it easier to breathe through the nose. That's how expansion can solve both the gum issues and the breathing problems at the same time. But there's more to breathing than just the mouth. Here's why you can't ignore what's happening with the tonsils and the adenoids. Let's talk anatomy for a second. Your nose is an amazing filtration system. It traps dust, allergens, bacteria, and the mucus, which can then be expelled or swallowed. Once swallowed, your stomach acid actually kills those pathogens. That's the way it's supposed to happen. But if your child is breathing through their mouth, all of that junk is going straight into the lungs. And now the immune system, which the tonsils and adenoids are a part of, has to handle the load. This chronic inflammation from mouth breathing can cause tonsils and adenoids to enlarge, which then further blocks the airway, creating a vicious cycle. Next, let's talk about ear infections. If your child has repeated ear infections, you might be surprised how closely that connects to palate width. Here's one most people don't connect to jaw development: ear infections. The eustachian tubes drain fluid from the middle ear into the back of the throat, right near the adenoids. If those adenoids are enlarged due to chronic mouth breathing or inflammation, they can block this drainage and lead to recurrent ear infections. Now, traditionally, the go-to solution has been either an adenoidectomy, which means surgically removing the adenoids, or ear tubes, which are tiny tubes placed in the eardrum to ventilate the ears. But here's the thing. Some studies show that expanding the upper jaw, if it's too small, can actually relieve the airway and reduce adenoid hypertrophy and improve ear drainage and stop the ear infections. And unlike surgery, expansion helps create space that was supposed to be there anyway. The upper jaw was meant to be about 3 to 5 millimeters wider than the lower jaw when fully developed. Restoring that can have long-lasting benefits: congestion, nosebleeds. If it's not, you need to know what that means for your facial growth. This next one surprises people as well, but frequent nosebleeds and constant congestion can also point to a problem with nasal airflow. Here's the counterintuitive part. The more you breathe through your mouth, the drier your nasal passageways become. You'd think that breathing through your nose would dry things out more, but it's actually the opposite. The nose is designed to moisturize and warm the air. Plus, nasal breathing stimulates nitric oxide production, which helps keep the nasal tissues healthy and open. It's like Mother Nature's Afrin without the rebound effect. Beyond teeth and breathing, expansion can actually influence your child's entire facial development and growth timing. So let's talk about facial growth for a second. Most facial growth and growth in general happens during sleep. That's when growth hormone is released. But here's the problem. If your child sleeps with their mouth open and their jaw hanging down, we tend to see more of a downward-backward growth pattern. You may have heard the term adenoid facies or long face syndrome. These are patterns of growth that we associate with mouth breathing and small jaws. The lower jaw drifts downward and backward, the face elongates, and the profile flattens. Now compare that to what happens when a child sleeps with the lips closed and breathes through the nose. The lower jaw tends to stay forward and upward. The face develops in balance and the airway expands naturally. And here's one most patients never connect. It all starts with the airway and being able to breathe through your nose as Mother Nature intended. This next one most patients never connect, and it's teeth grinding at night. Teeth grinding is a hidden clue, and this one shocks parents all the time. Grinding might be your child's way of surviving at night. If a child's airway is compromised while they sleep, their body may trigger grinding as a way to reposition the lower jawbone and open up the airway. It's called an airway protective mechanism. And I'm not saying every child who grinds needs a palate expander or that all grinding is because of sleep issues, but it's absolutely worth investigating, especially if grinding happens alongside snoring, mouth breathing, or poor sleep. Finally, let's take a look at the link between poor sleep, growth issues, and even attention problems, because the research here is clear. So we'll wrap up with this topic that's as controversial as it is important: ADHD. So ADHD is real and it's affecting more and more kids. But here's what's not talked about enough. Those ADHD symptoms might actually be signs of sleep deprivation. Kids who don't sleep well act like tired kids. They don't slow down, they speed up. They get hyperactive, they struggle to focus, they get labeled. In fact, in one study, kids diagnosed with ADHD who also had enlarged tonsils and adenoids and underwent removal of those tissues, afterward, half of them no longer met the criteria for ADHD. So think about that. If you actually have ADHD, it's not gonna just go away by removing the tonsils and adenoids. So what this was really showing us is that many of these kids are being misdiagnosed. If your child has already been diagnosed with ADHD or you're suspecting it, maybe your first stop should be to the sleep physician to rule out sleep as a potential underlying cause. And if a small upper jaw is contributing to the airway obstruction, it's not just about teeth. It's about brain development, behavior, and life trajectory. My name is Dr. Jeremy Manueli. Thanks for watching. Subscribe as always. Your smile is worth doing it right, and I'll see you in the next one.